first, when we talk about anatomy shopping, you must appreciate wants to shop. Okay, you must observe the aisle where they are stacking those things. You're very observant. Okay, must pick and compare. And then we said you must put in your cart. Okay, you must inspect and understand. Okay, you must go back and review. You must narrow your focus, avoid overloading, focus on what matters. So that's what we do. That's what we do. And that's what we're going to do here again. And then we're going to have exercise session. Okay. For example, what matters in anatomy, okay, are the structures of the thorax, the structures like the diaphragm, the clinical, the pneumothorax. Okay. All right. So let's continue. So that's just a brief begin of what we want to do here now. You follow? Once again, thumbs up if you follow. Drop in the comment section. Yeah. Hello, friends. Welcome to Anatomy Study Shopping. We're looking at what we had studied in the morning, and we are trying to appreciate anatomy with the concept of study shopping. When you want to go a shopping, or when you want to open your shop, either you want to go to shop or you want to open your shop, the first thing that happens is that you must have up your mind what you want to do. All right, so welcome to Anatomy Study Shopping, where we want to display in our shop for buy, for okay, excitement, for comments, for customers, for you know anyone, okay, to make one or two exchange, okay. So, but now we in the morning we have talked about diaphragm, okay, a whole lot about diaphragm, and then guess what? We started from the meaning of diaphragm, the introduction of diaphragm. After that, we talk about the definition of diaphragm. Do you follow? Yeah. After that, we talk about the shape of diaphragm. Excuse me, let me get some water. Okay, so let us start this evening. We are looking at anatomy shopping. Quite a pity, network has been on a glitch, and now we are up again to work. Now, in this shopping, we are going to, what happens in a shop? You display and you hear and you say to someone, come and buy, okay? Or you sit there and showcase. When you showcase, what you showcase, okay, harvest customers to come and sample your work. And then they observe, okay, and they pick and there's an exchange. Now, as just to whet our appetite on shopping. Okay, but due to time, I would have. Okay, let me just go straight and show you how to shop in anatomy, and then from there we can do the practical. You can see here a few active means to apply the concept of shopping to the study of anatomy. See what you need. You need to make up your mind. What do you want to study? Okay. What do you want to display? What do you want to share? Okay. You need to have a list. What do you want to study? Like, okay. And then I have a list. I want to look at anatomy of thorax and diaphragm. That's what I have in my list. So I won't buy anything else. I won't look at anything else except this. Next one, you observe the as. You watch the basic outline. You pick and compare. Okay, like for example, the arteries of the thorax, the arteries of the diaphragm. Okay, you put in your cards. That's the best you want. Okay, I've picked the arteries, so I know this way of retaining what I want. So anything arteries or anything openings, things like that. Then you narrow your focus, you avoid overload. So there are a lot of things in the material, but we pick just the basic one, and then you go back and review. They said revisit and reinforce for beta reflection. Are you seeing it now? So we are going to be looking at that. So let's see how to put this to practice. Now, here we are in anatomy. Anatomy, we talk about introduction, just like you introduce every other structures. Okay. Now, when you introduce anatomy, please take notes. We said anatomy of the diaphragm. We said the diaphragm, okay, is the chief muscle of respiration. We say CPS. The C there stands for the chief muscle of the respiration, principal muscle of respiration, chief muscle of respiration. The P there stands for the passageway, okay, for structure in and out of the thorax, okay, in and out. Saves as a pass. In fact, there are openings in the diaphragm. If we talk about the major openings, we talk about the minor openings. But I missed that. I cite that there are the diaphragm serves as a passageway. Okay. Now the S there stand for the separation. The diaphragm separates the thorax from the abdomen. Diaphragm separates the thorax from the abdomen. Okay. Moving away from there, we said the next concept is the diagram. You can see this is a typical diagram of a diaphragm. Okay, it's a good diagram of a diaphragm. You can also sketch another one because we say you don't study only one material. Okay, but then you can sketch another one where you have the mediastinum. Okay, where you have the mediastinum. Okay, can see. Yeah, this has more labels because I have at least 5 to 10. Okay, 5 to 10 labels. Can see this is the one that has the openings. And this is the diagram that shows you the insertions and the origins. Okay, the insertion and the origins. This one shows you, okay, the openings, the insertions, the origins. All right, so thank you. So we said the shape of the diaphragm is dome shape. But we use the acronym CIAS dash CORALDIM. CIAS CORALDIM. You must put dash between CIAS, put dash between the CORAL, and then put before you write dim. So CIS dash hyphen CORAL hyphen and then DIM. What does it mean? CIAS stands for concave in its inferior abdominal surface. So the diaphragm is concave in its inferior abdominal surface. I'm going to take that again slowly. The diaphragm is concave in shape in its inferior abdominal surface. In its inferior abdominal surface. Do you follow? Drop a message if you follow. Drop a message in the comment section if you follow. Okay? Now you can give a thumbs up there if you follow. Moving away from there, we say the CORAL represent the convex. The convex on right and left. So the diaphragm is convex, okay, on the right and convex on the left. That's this convex. It's convex, okay. But if you look at it inferiorly, on its inferior abdominal surface, it is concave. Now, if you talk about the middle is what? Is depressed in the middle. That's why we say dim, DIM, depressed in the middle. Do you follow? Some people always take picture like this. That's diaphragm, depressed in the middle. But I wonder why they smile when they take picture that way. Let's leave that for these picture takers. Now we pick the next concept we want to display. The next thing we want to display in this shop is the opening of the diaphragm. Remember, we have displayed the shape of the diaphragm, the meaning of the diaphragm. We want to pick the opening of the diaphragm. Now, from the meaning or introduction to the diaphragm, you can bring out definition that the diaphragm is a musculofibrous partition. It's a musculofibrous partition between the thorax and the abdomen. Remember where we started from to display our anatomical structures in this shop. Yeah, it started from the meaning of a diaphragm. Do you follow? That a diaphragm, okay, is introduced as the chief respiratory muscle, CPS. C for chief respiratory muscle, P for the passage of structures in and out of the thorax, and S for the separation between the thorax and the abdomen. Do you follow? That's where we started from. Now we move into seeing that the diaphragm, okay, has a shape on its inferior abdominal surface. It is concave. We call it CIAS, concave in its inferior abdominal surface. That's the full meaning of CIAS. Then CORAL, cora, all right, or core, all right, we said it is convex, okay, on its right and to the left. Concave on its right and to the left. Moving away from there, see how we are saying this in slowly because we want you to get it. We are saying it slowly to sample our anatomy of the diaphragm and thorax. Do you follow? All right. Moving away from there, we said the diaphragm. Okay. The diaphragm is depressed in the middle. Let's say this is the xiphoid process. This is the let's say this is the sternum. This is the xiphoid process. This place now is depressed in the middle. This is the diaphragm. It's like that. Okay. Let's speak definition of the diaphragm. The diaphragm is defined as a musculofibrous structure. The diaphragm is defined as a musculofibrous structure that partitions. Let's say this is my blue kaftan now. And see, this place here now is the diaphragm that partitions the thorax from the. Do you follow? Good. Write it down. The diaphragm separates the thorax from the abdomen. So it is a musculofibrous partition, meaning it's a muscle that has fibers. You can see it is a muscle. One muscle that have a whole lot of fibers. A whole lot of fibers. Okay, let's move on. Now, we now want to talk about the openings of the diaphragm. The openings of a diaphragm. The diaphragm has two openings, the major openings and the minor openings. So I'm writing and talking to be sure that when you hear me and you write, you are following. So try my best to repeat and to reconnect and to start from the beginning every time. Because this is anatomy shopping, we are displaying what we learn in the morning and we're sharing with you. Okay. Now, the diaphragm has two major openings. That is the major opening and the minor opening. The major opening is divided into three. The minor opening is divided into, you can say, 5 or 6, depending. So we have VOA, voix. The V is the venal caval opening. The venal caval opening. You know, inferior vena cava now. Yeah, so that's the thing. The opening of the inferior vena cava. And we say the inferior vena cava, part of it empties into the subcostal vein. All right. So the ascending lumbar vein empties into the subcostal vein, and the inferior vena cava vein, okay, and part of it empties into the subcostal vein, and the subcostal vein empties into the what? Hemiazygous vein, and the hemiazygous vein empties into the accessory hemiazygous vein, and the accessory hemiazygous vein empties into the azygous vein. Okay, so we are coming to venous drainage, so you appreciate better. So that about that. Openings 3: vena cava opening, osuvecus opening or osophageal opening, aortic opening. These are 3 structures that create an opening in the diaphragm. And we have to be very careful, because when the opening is unnecessarily enlarged, it can cause an organ in the abdominal region to want to enter into the thorax, and that will lead to hernia. So the possibility or proclivity of any organ to want to enter into the thorax through any of the opening Okay, so we continue. Major opening, number one, vena cava opening. We talk about inferior vena cava. Okay, so there is an opening in. Okay, now we also talk about oesophageal opening. There's an opening, it lives on the diaphragm. Oesophagus lives on the diaphragm. We talk about aortic opening. There's an opening that the aorta lives on the diaphragm. Okay, now we continue. There are minor openings. These minor openings, we call it SMS SHA. SMS SHA. What does that mean? The first S stands for splanchnic nerve. That is the greater and lesser splanchnic nerve. So the splanchnic nerve, greater and lesser splanchnic nerve, leaves an opening on the diaphragm. So I'm going to say that again. S is for splanchnic nerve. Splanchnic, SPLANCHNIC, splanchnic nerve is an opening that lives on the diaphragm. The next one is the musculophrenic vessel. Musculophrenic vessel. Musculophrenic vessel. There's a minor opening, the musculophrenic vessel lives on the diaphragm. Do you follow? The first one, the splanchnic nerve. The second one, the musculophrenic nerve. The third one, the superior epigastric vessel. The superior epigastric vessel. They also leave a minor opening on the diaphragm. Now, we talk about SMS SHA. This next S is called subcostal nerve and subcostal vessels. Once again, they leave minor openings where? On the diaphragm. I'm going to run that over again in case you need to write, which you should. We said number one, SMS SHA, that is SMSSHA. Those are the acronym for remembering the structures that leave minor openings on the diaphragm. Do not forget the structures that leave major opening, that is a large, a big opening on the diaphragm. VOA, voir. Okay. The verb avoir. Okay. V for vena cava opening. That is the inferior cava vein. There's an opening it leaves. That's a great vessels of the thorax. So there's an opening it leaves on the diaphragm. Okay. Good. Now we talk about oesophageal opening. The oesophagus leaves an opening on the diaphragm. Do you follow? Drop in the comment section if you're following. The next one is the aortic opening. The aorta leaves a big opening in the diaphragm. Do you follow? Good. Now the next thing we are looking at is the minor opening. We said SMS SHA. SMS, S stands for what? The splanchnic nerve. Splanchnic, SPLNHNIC, splanchnic. Okay, so we are still talking about the anatomy of diaphragm. That the diaphragm has minor openings. The minor include SMS, SMS what? SMS SHA. That's SMS SHA. Well, let me send SMS SHA. Okay, send me SMS SHA now. So as you discuss your normal common language today, you also bring in this anatomy. Okay, let's move on. The next one is for splanchnic nerve. We have greater and lesser splanchnic nerve. Okay, the M is musculophrenic vessel. Musculophrenic vessel. And the next one is the superior epigastric vessel. Superior epigastric vessel. All right. Next one, we talk about the SHA. That's the S now is the subcostal what? Nerve and subcostal vessel. Okay. Now, the HA stands for what? Hemiazygous vein. Hemiazygous vein. So, those are the structures that leaves minor opening on the diaphragm. Now, it's on this material. You can see it. See? Subcostal, superior epigastric, musculophrenic vessels. Okay? All right. Say SMS SHA, SMS SHA. All right. So we move on. We now want to talk about the origin of the diaphragm. The origin of the diaphragm. Diaphragm has three major origins. We call it CVS. Okay? And then CVS, C for costal origin, V for vertebral origin, and S for sternal origin. V for vertebral origin, C for costal origin, and S for sternal origin. Do you follow? Okay. Now, the vertebral origin, okay, has two major grooves. You can see the grooves. This thing that look like red beside a yellow tube, okay, is the grooves. The one to the left is the left grooves, and the one to the right is the right grooves. You can see the splenic nerve, okay, greater and lesser splenic nerve that pierces or gives a minor opening on the diaphragm. You see it now? You see the vena cava opening, major opening. You see the os suffocus, major opening. You see the aorta, major opening. All right. So these are some of the things you take note. These are some of the things you take note. All right. Then moving away from there, we talk about what? The origin of the diaphragm. The origin of the diaphragm. Diaphragm has three origins. CVS is the acronym. C for coastal origin, V for vertebral origin, and the S for sternal origin. The sternal origin is just from the posterior surface of the xiphoid process. The xiphoid process is the end, triangular end, okay, of the sternum. Now, the surface is the inner lower six, the inner surface of the lower six ribs, the inner surface of the lower six ribs. Okay. Now moving away from there, we said the vertebral surface have right and left cruise. The right cruise is the longest and the most muscular. The longest and most muscular. Whereas the left one is on L1 and L2. Whereas the right one is L1, L2, and L3. Okay? The body and intervertebral disc on the body and on the body and on the intervertebral disc of L1, L2, and L3. That's the right cruise. Cruise is spelled C-R-U-S. Now the left cruise, okay, the left cruise, you have it on the first and second lumbar vertebra. On the first and second lumbar vertebra. On the first and second lumbar vertebra, the left cruise. And this left cruise, okay, that's the first origin. The second origin is what we call medial arcuate ligament. Okay, medial arcuate ligament, which eventually insert on the lumbar vertebra and the tip of the transverse process. Call it we call it medial of the medial arcuate ligament. Okay, we are getting some. So the is another origin or that from the left cruise. But this time they still insert, okay, on the side of the lumbar vertebra and on the tip of the transverse process of that lumbar vertebra. Okay. Now, moving away from there, we said this issue of origin is still another one. Now, we say poma. I can recall it now. Poma, not mora. Poma. What is poma? Base of medial arcuate ligament. Poma. Then the other one is polar. Polar. You want to go to polar. What is it? Base of lateral arcuate ligament. So, as we talk about the left cruise first gives you origin from the what? The body and the intervertebral disc. 2, it gives you origin from the pairs of the medial, the two sides of the medial arcuate ligament. The medial arcuate ligament. Do you follow? Hope you're writing it down. Good. And then it eventually inserts on the side of the lumbar one, that's L1 lumbar vertebra, and on the tip of the transverse process. You should have gotten that by now. Okay. Let's move to the next one because this is very important. The diaphragm also originates. Diaphragm also originates. Okay. From where again? From the base of lateral arcuate ligament. The other one was from the base of medial arcuate ligament pomal. This one is from the base of lateral arcuate ligament polar. P-O-M-A-L. P for pairs, O for off, M for medial, A for arcuate, L for ligament. For the lateral, P for pairs, O for off, L for lateral, A for arcuate, L for ligament. Those were the things we had in the morning. We went shopping in the morning, and I'm displaying it here. Then moving away from there, we said, aside from the opening, major opening, VOA, that is vena cava opening, aortic opening, os vagus opening, we talk about the SMS SHAS, that's SMSSHAS. That's the first S is for the splenic nerve. You can see the splenic nerve when they were, perforating, creating holes on the diaphragm. On that picture, you can see the greater and lesser splenic nerve, creating small holes. You can see the inferior vena cava and the right phrenic nerve. You also have the left phrenic nerve. Okay, you see the vagus nerve. There are several nerves. You see, several nerves that create this thing. So they are just picking some. Create holes, minor openings on this diaphragm. You can see it. They are just picking some. See the median arcuate ligament. Okay, see the median arcuate ligament that gives you the origin. So part of the diaphragm originates from the median arcuate ligament. Also originate from the lateral arcuate ligament. Some also originate from the median arcuate ligament. You see, originate from there. Now, while some others also originate from the tip of the transverse process and the side of the lumbar. Do you follow? I'm stretching it. I'm showing you as I'm talking this thing. Okay. Now let's move on. Let's take a little bit faster. We'll end the session by 30 minutes past this time. Okay? Next 30 minutes, we should finish this. Next thing we want us to learn is that the diaphragm has, we talk about the introduction as chief respiratory muscle, passage for structures in and out of the thorax, okay? Just where you have inferior aperture of the thorax. Talk about the separation, partition between thorax and abdomen. Talk about the diagram, told you the different leveling. Talk about the shape. We said it's dome shape. Medially, it is depressed, DIM. And then on the side, right and left, it is convex. And then by inferior, on its inferior abdominal surface, we say it is concave. And then we talk about the openings. We say the major openings and the minor openings. Major opening, VOA, voir, that is vena cava opening, esophageal opening, and aortic opening. Minor opening, we said SMS, SHAS. That's chance. Okay, moving away from there, we said the SMS, the splenic nerve, greater and lesser splenic nerve, the M musculophrenic vessel, the S is the superior epigastric vessel, the SS superior subcostal nerve and subcostal vessel, the HA is hemiazygous vein, the S there is the sympathetic sympathetic trunk nerve, sympathetic trunk vessel. That's another vessel that, and you saw the vagus nerve there. It pierces, so the vagus pierces. Now, origin of diaphragm. We have three origin. The median, the sternal origin, vertebral origin, and the costal origin. The vertebral origin is left and right. The sternal origin is from the posterior side of the want. Posterior side of the want. This is not clear. Let me get to where you can see my face, because seeing is believing. Yes, seeing is believing. When you see, you believe. Okay, then you can see me here now. We said the diaphragm is what? The diaphragm, I think you should even see my eye very well. The diaphragm, okay, originates from three places. Okay, the sternum, back part of the xiphoid process of the sternum, then the costal surface, okay, where in the costal surface, where you have the inner surface of the lower 6 ribs, okay, now between the inner surface of the 7 ribs, okay, and the xiphoid process is an opening. That opening, we call it the Morgani space or Morgani foramen. Yeah, Larry space or Morgani foramen. Morgani is Morgani, Morgani foramen. Larry is called Larry, Larry's space. Moving away from there, talk about the cross, left and right cross in the vertebral origin that gives off what? The origin, the vertebral origin of the diaphragm, meaning the diaphragm originates from vertebra. In that vertebra, there are two places, the left and the right. Okay, the left screws and the right screws. The left screws has the longest, because you have L1, L2 body, front body, anterior body, and the intervertebral disc. And then moving away from there, we talk about the right screws. Okay, the left screws. It says divided into 3. We have the first one is one that originates from L1 and L2. Okay, the body and intervertebral discs of L1 and L2. There's another one, it originates from the medial arcuate, from the base of medial arcuate ligament, we call it pomal. The other one, polar. P for base, O for off, L for lateral, A for arcuate, and L for ligament. Polar, base of arcuate, base of lateral arcuate ligament. Base of lateral arcuate ligament. We talk about what? What do we have? Yeah, that's for the ligament. From this structure now, you can see that the diaphragm also originates from the median arcuate ligament. Not only the medial arcuate ligament, but also the median arcuate ligament. Okay. So that's a lovely one. That's the power of picture. You can see a picture can tell 1,000 language. All right. We've talked about all those things. Now, what's the next thing we need to look at? The relation of the diaphragm. Okay. We said PP, pleural and pericardium. PP, pleural and pericardium. Whereas the other one is kid like SPS. Kid like SPP. So kid like species. Kid like father species. What's the kid? Kidney. Like is the liver. Father is the fundus of the stomach. And the SPP is the spleen. P there is the Okay, let's leave that. And then the S is the suprarenal gland. Peritoneum. 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 It just occurred and my eyes was looking at that. Okay, so we move away from there. You've taken note of that. Taken note of that. What else did we consider? Venous drainage of the diaphragm. We said all the veins that accompanies the artery that supply the diaphragm drains into systemic vein. Question: what then are the arteries that give blood supply to the diaphragm? This is muscle. Did you see muscle? Anatomy of the muscle. Remember what we said? Intends to doctors take only important action before nurses can leave clinic. The before there stands for blood supply. That's when discussing muscle. That's the mnemonic for remembering the outline. Intern student doctors stands for introduction, stands for shared, stands for diagram. Take only important type of muscle, origin of muscle, insertion of action of muscle. Take only important action before nurses can leave, before its blood supply can stands for what? The cause, yes. Where does from where to where does it move? And leave is the leak is the lesion. Clinic is the clinical significance. So as we are talking about this muscle here, which is diaphragm, that's exactly how we discuss any other muscle. If you claim you have read a muscle, ask yourself which blood supplies the muscle, especially very large and very important muscles like this. These are muscles of interest in anatomy. Okay, so moving away from there, we have what? We have the blood supply. We said U slim soup. U slim soup. U slim soup. So that soup is a very slim soup. What does the spelling? U, draw a hyphen. SLIM, draw a hyphen. SUP. The U there stands for upper right lumbar artery. There's another U there in soup. That one stands for upper left lumbar artery. Now the S in slim stands for superior epigastric artery. The other S stands for superior phrenic nerve. If there's a superior phrenic nerve, it means there's an inferior phrenic nerve. And if there's an inferior phrenic nerve, it means there is a musculophrenic nerve. Remember, this is also another vessel that leaves a minor opening on the diaphragm. Are you seeing how this thing is connecting now? All right, so we talk about the L there stands for lower third posterior intercostal artery. We call it LT, PIA. LT, as lower third, PIA, posterior intercostal artery. Good. Then what else have we not mentioned? The P, pericardiophonic nerve. Sorry, artery. Look at it here. Artery that supplies. Okay, it should be down there. Pericardiophonic, yes. Pericardio, you can see it now. These are all those things I was talking about. Okay, so those are the blood supply, that's the blood supply. Action. Okay, what's the action? We said MDX. MDPVCR, the PVC of MD, the managing director's PVC. What does that mean? P is M is what? Micturition, urination, micturition, to urinate. All right. D there is defecation. So the action of the diaphragm as most helps you to defecate. Without the diaphragm, you can't defecate. It helps you to defecate. The diaphragm helps you to micturate, to urinate. It's part of the muscle that helps in urination. Okay. Then PVC, the P there is parturition. The diaphragm helps in giving birth. Okay. And then we talk about V there is vomiting. Without the diaphragm, vomiting is not possible. And then C there is for chief, is responsible for respiration. That diaphragm, they can be respiration. So the CD stands for chief respiratory, is responsible for chief respiration. Okay, chief muscle of respiration. Then for the clinicals, we said cheaper or cheaper, yeah, cheaper. C there stands for, it can be some, it can be the C there. Okay, let's look at H, hiccough. I there is for irritation. Okay, and the A there is for acquired hiatus hernia. Okay, yeah. Check a look. I just took a look. The C for cheaper is for collection of pores. Okay, pneumothorax, collection of pores. Okay, these are the things we consider in the morning, and we are ending this session here. Talk about the action. The nerve. Okay, I've not mentioned nerve supply. The nerve supply of the diaphragm is not much. We have sensory nerve. We also have motor nerve. The sensory nerve is the phrenic nerve C3, C4, C5, and then the sensory nerve we have the central and the peripheral. Central is the phrenic nerve, and the peripheral is what is the lower C6 and C7. Of course, it should be intercostal nerve. All right. So what else have I not discussed? I think I've discussed everything about the diaphragm. Don't forget, diaphragm, we got it from the thorax, and we said the thorax, right? The thorax is what? The thorax, we'll discuss it under JEC CFIM, that's JEC as well as very tall rabbit travel very bright streets to avoid cars. The vertebral level, very tall, there is thoracic outlet. Rabbit is the relations of the thoracic inlet, and then travel, there is thoracic wall, and then very, there is vascular venous drainage. Bright street is the blood supply, and the street there is the spaces, intercostal spaces. All right, to avoid car is thoracic cavity. Okay, the organs there, okay, in the potential space, one of which is this diaphragm we are talking about. Okay, and then what else? We talk about the last one, which is travel to avoid. Avoid is the action, okay, of the joints and muscles of the thorax. And talking about thorax, okay, because we said we are going to display diaphragm and thorax in today's anatomy shop. So you can decide which one do you want us to teach you, which one do you want us to have a live session with you as our guest in the night. Is it diaphragm? Is it thorax? Okay. Is it the Jack C film? Is it a very tall rat? Okay. Travel very bright streets to avoid car. Is it the spaces? Is it the cars, the clinicals, the action? Which one do you want us to teach you? You drop in the comments so we can give you a link to join us as a guest and learn. Okay. You follow? So that's why we raised this session. In the night, okay, we'll be having another session by 8 p.m. Please make it a date, make it a deal. Is it okay? All right. See you at the top. God bless you.